A lot of questions that I get from patients is, how did you get into dentistry? My dad's actually a dentist and he's still practicing dentistry in Michigan. So I've been around dentistry my whole life, and he actually took the practice over from his uncle. So I remember when I was probably 3 or 4 years old, the cool thing at dad's office was going and putting my hand in Elginet and then my dad pouring up my stone fist, and I would give that to my family members for Christmas presents. So I was kind of involved in the dental field at a young age, and I got to see what my dad was able to do for patients. And a lot of my dad's closest and best friends are some of his patients that he's been working with for 30 years. And that really resonated with me. I think I really enjoyed the aspect of how you can treat someone so well that they're willing to stick with you no matter where they move or where you move for years and years and years to come. Once I got into dentistry, I kind of took that same passion that my dad has and incorporated that into my style of practice. I don't like to push treatment. I don't like to rush through things. I like to treat everybody as family and really sit down and get to know you, as an individual. And I feel like that's one of the things that you kind of see dentistry shifting from, and medicine in general. It's kind of like shorter appointments, quicker appointments. And I just don't like that. I like doing things a little bit more old school. And I know some of our older patients really respect that because that's where they came from. They were used to sitting down and knowing the doctor by their first name and maybe seeing them outside of the office. And that still holds true with how I like to treat patients today. So, a lot of the competition I feel like in this area, and one of the things that makes maybe my approach different is the comprehensive treatment, and I want to sit down and I want to shake the hand of every new patient that comes in the door. I want to get to know you, your family, your hobbies, your interests, and really just take the time to to get to know one of another and establish some rapport, opposed to just being like, okay, Mrs. Jones, you're in the office, this is what you need, I'll see you at your next visit. Like, I don't think that works very well, and I don't think that really builds a trust or a friendship with your dentist. So I like to focus on that.